welcome everyone to the HCI Latin America and the Caribbean region roundtable. This is the second roundtable that we're having. Some of you participated in our first one back in June, which was a very robust discussion about how you're all doing in response to COVID-19 and how it's impacted your institutions, something which HCI truly cares about in terms of our members, both internationally and of course in this region. So we are going to start with Valeria as our facilitator, who will give some remarks. And then you have the agenda that I circulated. So we will have a president's report from our president and CEO, Dr. Stephen Cantor. And then we will talk about mental health and medical education, where Dr. Rogers Shamas at USP will provide a brief overview, and each of you will have 3 to 4 minutes to share your insight on this topic, and then we'll conclude with the general discussion.
Oh, good afternoon, everyone. So I'm Valeria Oki, representing the Latin American Regional Office. I'm the current vice president of the international office at the University of São Paulo Medical School. And we're honored to have you in this session. I think these roundtables are very relevant and all the experiences must be shared. So Professor Cantor, thank you very much for the opportunity, and we have the honor to have you here in this session. So I would like to invite, we have here 3 countries represented. Oh, in fact, 2, right? So Brazil with 2 institutions and Mexico here. So please go ahead, Professor Cantor, take the honors.
Yeah, thank you, Valeria. It's very nice to see everybody, and greetings from LAHCI. And, you know, I know how busy everyone is, and I know these are very challenging times, you know, the pandemic and fires and explosions and damaging storms. And, you know, was on a conversation recently, and somebody asked me, what gives you the most hope in these very challenging times? And, you know, my answer is it's what I see in all of you. You know, it's the dedication and commitment that I see to help get us through this, to take good care of people medically, and to help us build a path to a new normal and make the world a better place. And so that's what gives me hope. And I'd be very interested as we go around to hear the kinds of things that give you hope in these difficult times. And so I appreciate what you do every day. I want to recognize the University of Sao Paulo for its leadership in the region and very high level of engagement during the pandemic. You know, the newsletter was excellent. The webinars and roundtables have been outstanding. And the attendance at the webinars have really been strong. And in addition to that, there are a number of people looking at the sessions on YouTube. So what you're doing is making a difference and impacting people around the world. Appreciate the leadership of Dean Filo and Professor Segavaro, Dr. Krieger, Professor Auler, and certainly Dr. Aoki and Talita for all the things that you're doing. The other thing I'd like to congratulate the LAC Regional Office on is the Student Leadership Initiative. Launching that has been a lot of fun for us, and we look forward to seeing what the students come up with. As I think Valeria mentioned, AAHC just completed its annual meeting. We did it all virtually. So Valeria, I know I saw you there, others may have been there. If you weren't there and you want to watch something, we can make that available. I don't know if you're going to email that around or put a link in the chat, but we can make that available. Those sessions are open. You know, we've waived fees for all the sessions, so you can take a look at whatever you would like. really high quality sessions, and the evaluations, we were worried because it was all virtual, but the evaluations were really outstanding. And the last thing I'll mention is we are also have developed a new program based on our AIM consulting program. We're calling it AIM Connect. It's a 1-hour consulting session with 1 or 2 leaders around a specific issue. And we're offering that as a member benefit to any member who wants to take advantage of it. Just let Chris and her team know, and they'll set up an hour session with the appropriate consultant. And so just to, create a little more connection and interactivity during the times of the pandemic. The pandemic really highlights why it's so important for us to work together, and why it's important for academic health centers to work together. People keep saying the virus doesn't need a passport to cross borders, and electrons don't need a passport to infect someone's computer in another country. So really important for us to work together. And so I really appreciate what each of you are doing. So congratulations, and thank you. And I'll turn it back over to Valeria.
So Professor Chamas, our Vice Dean, would you like to start then the session, pointing out your comments and impressions, in your experience, what happened to the mental health of our students, please?
Thank you, Valeria. Good afternoon to all. It's a pleasure for me to be here. And one thing that I'm on the impression, and I'd like to hear the comments of you all, is that we are now in a better position to deal with anxiety and lead with uncertainty. I think that the legacy of the pandemics will be how we deal with the unknown. There's a great opportunity there to highlight the importance of science in dealing with unknown and uncertainty. This is the positive side of the pandemics. A negative flavor to that is to live with anxiety. And I think that this will make us, obviously there's always a positive side of a physiological positive side of anxiety, but we need to we need to learn to cope with that. And somehow we need to facilitate our students, residents, and grad students to learn to cope with it as well. The impact of anxiety in performance will certainly be something for us to study more and try to circumvent the problems and barriers that this may pose to some of our students. And to learn with those that take this as an opportunity to grow and try to use this as a model for all the people we are educating, and we are educating ourselves as well. So there's a learning process for everyone here, and it's a very interesting time. At least for me personally, it's been a very interesting time to learn to cope with the frustration of not being able to do whatever we like the most, and eventually take the opportunity to change that in a way that we can communicate what the thing in a better and a more effective way. I would like very much to listen to your comments, either now live or afterwards. Unfortunately, I need to leave in a while, but I would like to leave a positive note on that, I'm pretty sure we will learn a lot. And after we make this with science, we make our environment a more safe way, a more safe environment. We will take the opportunity, and I'm pretty sure we will be leading better with how our emotions interfere with our learning, with our learning experiences. And this is what I take as the most important thing from this pandemic for me. Valeria.
Thank you, Professor Chamas. I'll just greet Professor Julian Santiago. Hello from Antioquia. Hello, very nice having you. Can you unmute, Professor?
Hello, how are you?
Fine, and you? Thank you for joining us. So we have now the three countries represented, Professor Cantor. So I'll just pass the word to Professor Martins, who coordinates the medical students. Please, Professor, could you show us your input in this matter, the mental health of our students at the medical school?
Good afternoon, everybody. Thank you for inviting me. I'm very happy to be here. And just a brief comment about what is happening here at the University of São Paulo. We have to move rapidly to online teaching with new challenges. We needed resilience, creativity, patience, and I think it's a problem that all medical schools had in all countries. Concerning mental health of both medical students and the academic community has been a very important issue before the COVID-19 pandemic, and new challenges arose in these difficult times. And I just want to share with you 3 lessons we learned during these months of COVID-19 pandemic. The first one is the importance for us of our Center for Development of Medical Education. We have a group here with the leadership of Dr. Patricia Tempsky that had an open door, both physically and virtually, almost 24 hours a day, to give support to all our faculty. This was very important for the mental health of faculty and students. So the first lesson is the technical support to this transition from to remote online teaching. The second lesson is this: we must try to keep our medical students connected with us and with the medical school. And we developed a lot of strategies to keep them connected. Meetings with the students, frequent feedback from students and from us to students, and other activities, distant activities, but music, literature, cooking lessons, to keep them connected with us. I think that the dialogue between faculty and medical students has been more intense than it was before the pandemic. And the third lesson is offer support to medical students, offer a lot of kinds of support to mental health, so online psychotherapy, online psychiatric help with COVID-19 issues, if the medical students became sick or their parents or their relatives to help them with this. Emergency financial aid, a lot of people lose their jobs and became with financial difficulties. We also helped them with connection, our medical students with financial economic difficulties, received Chromebooks, received kits to access internet. We offered them online mentoring. So keep them connected and offer support, I think, was the biggest lessons from this pandemic, to help them concerning mental health. We are very fortunate that we didn't have any serious mental health problem with our medical students, and we believe that the reason for this was this support and this connection. Thank you.
Thank you very much, Professor Martins. I am one true witness of this really deep involvement of all your committee. I think it was essential. So, Professor Maria Cristina Lima, would you like to address your experience at UNESP as well?
Yes, I would like to share some slides. Is possible?
Yes, go ahead.
Everybody can see?
Yes.
Yes. Again, good afternoon, and thank you for this opportunity. My name is Maria Lima, and I will present briefly how mental health was affected here, and how we are dealing with that. In this infographic, we can see Brazilian situation, and São Paulo state is in this area. São Paulo is the first in number of the cases, and here is São Paulo state. In Botucatu is the city when I live. We are 200 kilometers from São Paulo, and Botucatu is part of the UNESP, multi-campus university. So we have to obey some guidelines from the university. In March, the government suspends all classes in universities in São Paulo state. And our pandemic history starts. I would like to invite you all to think about the onions, because it is an image that helped me. We have some layers, and when you, on the surface of these layers, we can see insecurity from our students and our staff. Isolation, people got tired or bored with isolation, fear of contagion, and our students were worried about not finishing graduation. And they said, oh, I will not become a doctor. The class are suspended, and we are afraid of that. But if you pay attention, in deep layers, we can see fear of death, their death, my death, I have this fear, or friends or family. And many students were worried about, I'm not sure if I want to be a doctor. And as professor, we have to detect, we need to detect and to be open to receive and deal with those feelings, all of them, and how to help. Regards fears, we have to legitimize. It's normal to be afraid in pandemic. As Milton said, do not be alone, be connected. Because we have students with financial problems, we have to literally be connected. And we have a program with we need to buy, and we have a donation, a computer donation for these students. We needed intensify the psychological support program and meeting with all of Meet, Zoom, Teams, and not for classes, only class, but social meetings. We encourage people to open their cameras to see each other. In many class, students, they keep their camera closed, and it is very bad for us, professor and students. And we intensify our mentoring programs. Regarding insecurity, we have a program to personal protective equipment, like face shields, masks. We have virus screening in saliva for people not symptomatic, and a self-reported symptomatic app. And of course, we intensify our partnership with health service. All of them, they are part of a national health system, which is very, very important for our country. Regarding graduation, we, as Milton said, we have to change our scenarios to adapt and decrease the number of students in each scenario. Fastly start to online learning because it's not only change the button. We have to organize task force for to distance learning to professors. And many students were disappointed because they were only online. So we will help them to organize volunteer works, as, for instance, call for older patients, organize preventive and informative medias. And we keep people know about the reproduction number in our area. It is around the reproduction number is around 1 since June, and it is important. In the last week for that, we have a decrease 18%. That's it. Thank you for your attention.
Thank you, Professor Maria Cristina, for your valuable data here. So many of the information, I think they reach a common place with other experiences. So please, Mexico, Texalu.
Yes, thank you very much, everyone, for this opportunity to share some ideas that we have been working around mental health of medical residents and medical students. We think that there are 3 main points that we would like to share today. And the first of them is to emphasize the relevance that the pandemic has brought to the mental health issue. It has been published a lot of papers about the hidden curriculum, for example, that this pandemic has had for all health workers, But I would like to emphasize that this is only an opportunity to notice the relevance of this issue in our profession. It's not only because it causes some uncertainty about what is going to change, but also it's an opportunity to remember the impact of mental health of medical students and well-being that has been assessed and well documented, at least during the past 2 decades. And in this multicentric study, for example, in academic medicine, it showed a medical students' mental health correlation with professionalism, burnout, suicidal ideation, and thoughts of dropping medical school. Poor mental health was associated with suicidal ideation and thoughts of leaving medical school, regardless of burnout. And the prevalence of self-reported altruistic professional beliefs were decreased in stepwise fashion as mental health worsened, with a difference in prevalence reaching a statistical significance more often among students with burnout. So the impact in medical residents' well-being and mental health also has been unprecedentedly documented during the past 3 decades. Depression, suicide, substance abuse have become a fundamental issue to address in medical residency. Also, burnout and mistreatment in the training environment. In 2019, the New England Journal of Medicine published this US national survey of all its surgical residents. And we can see the results here. 32% reported gender discrimination and verbal or physical abuse. And and 10% sexual harassment and 38% burnout symptoms, which were more common with residents who reported mistreatment. And also mistreatment was associated with suicidal thoughts. So burnout, we have to talk about it because it is the epidemic of our profession, not only of our time. We know it has been with us for a long time, and research has provided the evidence regarding the personal and professional repercussion of physicians' burnout. Not only does it impact patient care and safety, but also our own well-being and mental health. So right now, I think we are facing both a crisis and an opportunity. We need to address the drivers of burnout in physicians, has lack of control, work-life demands, and work-life integration. And also, it's very important that we change this in the new paradigm of the 21st century in a competence-based education. Self-care and well-being have to be acknowledged as a professional competence for physicians and all healthcare workers. And yet again, maybe this is not a new issue, but perhaps it will be the catalyzed issue in the context of the COVID-19 pandemic. And just recently in 2019, the National Academy of Medicine in the United States published this report about the systems approach to professional well-being. And I think that this is very important to share a model of systems, a systems model of clinician burnout professional well-being that we can use to try to teach and learn self-care and well-being for our medical students and residents. So we have to work in the individual factors, but also in the environment and in all dimensions of the curriculum, not only the formal, but also the informal and the hidden curriculum. So I would like to end just by briefly sharing that taking this model, we design a well-being program for our medical students. I'm showing the Vanderbilt School of Medicine program, which is a pioneer on this kind of program. And that was successful by articulating the previous existing universities, support services and resources. In a program in our school for medical students, this program is delivered by mentors to medical students strongly focusing in a model of learning communities and peer support. And in the residency programs, we have a well-being program that focuses on both the academic and personal well-being and the professional development of the resident. The program includes the articulation of curricular design and strategies such as mentoring, group and peer strategies such as valiant groups, and support services such as the counseling, mental health services, and substance abuse prevention. And again, the pandemic brought a new challenge and opportunity because since April 2020, our program has been implemented fully in virtual electronic platforms. You are actually seeing in this slide the actual digital flyers that we use to promote the services and activities of the program with residents. The pandemic has brought us apart physically, but closer as an interconnected community. In conclusion, we think that a professional and human network could be the basics to influence the residents' academic and personal well-being, as well as their professional development, because residents' well-being is human well-being and dignity, and mental health is human health. We shall do everything in our hands and minds to flourish and to protect it. I'm thankful. Thank you very much for your time. Sorry I exceed the time.
Oh, thank you. Thank you very much for sharing such complete and very, very clarifying material. I think Habiba posted in our chat, there's a recording of all this experience. Thank you very much, Professor. So, I'm going to welcome Professor Mauricio Chaparro Solano. Hello, Mauricio from Colombia. Would you like to say hello to everybody?
Thank you very much,
Okay.
Dr. Valeria, and hello to everybody. Greetings from Colombia. So nice to be here with you, and thank you again for the invitation.
Okay, so we'll move to another colleague. So Professor Julian, would you like to comment on what has been presented here, Professor Santiago?
Thank you so much. Well, the truth is that I don't prepare anything because I don't know that I have to talk, but I have comments about the mental care from my students. Yeah.
Would you like to comment your experience in your university?
Okay. No, yeah. My students have a burnout. Yeah, because the truth is that the rotations is very hard because we have a lot of academic sessions and turns in the residence in the hospital. But for example, my university have a program that is called Bienestar, and it's about the goodwill for the students. And there we have a psychiatry and psychology that this is very important for us, and the students is go to this plan so much. And well, this is a program that is very important because it's I don't know, a pioneer in my country. And we have another thing that is the students when they have burnout, we discharge the rotations and they have something like vacations. But yeah, we have the problem that the others university and the others country.
Thank you for sharing. So Professor Chaparro, would you like to address your experience as well?
Thank you very much, Professor Valeria, again. Well, just for for the ones that don't know me before, I'm the head of the medical education department at one hospital in Bogota, the capital of Colombia. We are the biggest hospital in number of beds of the country. And in that relation, we had more or less per month, 100 residents we could have, maybe. We face the same problem probably that other hospitals here or other school of medicines represented in this roundtable. And is that our students, especially I'm just talking about residents, they present, for example, burnout or depression or other symptoms, but we don't notice them. It's really hard for residents and for students to talk, to explain, to let us know what is happening inside of their services and inside of their rotations. And when you don't know, it's so difficult to make something about it. So that's the first problem. I will really like to hear probably the experience of the other attendees related with this, how to make or to inspire your residents to talk without fear, to let us know what is happening in one case. And the other thing is that even though we had tried a lot of different programs, we had offered them sessions for talking with psychiatrists, with psychologists, other type of activities, for example, coloring mandalas, well, many activities for the residents, but they don't like to attend them. We don't know why. Yes, we invite probably 30 per session, but only 5 or 10 attend the sessions. I don't know if probably they don't perceive these tools as helpful, just they probably feel they're losing their time when they attend to these programs. So I would like to know the ones that have these kind of programs, if their residents go to them, and if they go, how you make them going, because we haven't been able to do that. Thank you.
Thank you, Professor Chaparro, for letting us know what your experiences are. And I think that pretty much what the residents face, the students face as well. It's only a matter of different years of graduation, but please, I'm opening the discussion. Just raise your hand here on the screen. And Professor Milton, would you like to put a comment on what was said here?
I think that it's very important to share our experience, because we have the same problems, we have the same challenges, and one thing it's very important is that because the COVID-19 is so new, so recent, we don't have a lot of data concerning mental health during COVID-19 pandemic, and we need more data to help better our medical students and medical residents. But we saw a lot of experience of keeping doors open, keeping connection, to talk, to listen, to understand, to share. Sometimes what we can do is just to listen and to understand and to empathize. And we need time to do this, but it's very important to give this time of help, this kind of help.
Maria Cristina, Mary.
I agree with Milton, and I think we have chronic problems about mental health, and with this time, pandemic time, of course, everything gets worse. So we need I don't know in English the word for acolher. I don't know if my Brazilian colleagues here can help me, but it's a kind of listen, a special listen. When you listen and you understand and you put yourself in the other shoes and you can almost feel. And it's a kind of special listening we have to have in this time. But I think we all the time we have this problem. We have to see the other, and we have to listen the other. And of course, in pandemic, all things get worse. This is my comments.
Mary, would you like to add something?
Yes, I have been reflecting a lot about this issue and this pandemic scenario, and my personal and professional conclusion is that this is a great opportunity to address a very delayed issue in our medical education and health systems practice, which is the competence of self-care and well-being, has a professional competence, not has an additional extra human dignity concern, but has a professional and a competence and has an institutional social responsibility, which will mean that we have to address it as a formal challenge with a formal structure and programs and resources to impact not only the individual factor of the person, of the healthcare workers and medical students and residents and fellows, but also the environment itself. And not to forget the resiliency training, but also the factors in the environment that promotes resiliency and well-being. And yes, we have to say it too, that there have been great learnings from this pandemic about that we can change we change the shifts hours, we change the duty hours, and we change the resting hours, and the residents are doing better because of that. But on the other hand, as are struggling with the fact that we have more deaths and more risks related to not only the COVID-19 SARS-CoV-2, but also to the other medical health issues that have been that we have been dealing with the general population. So this is a crisis, but also an opportunity, and we have to be very, very careful not to let the mental health care of medical students, residents, fellows, and physicians and healthcare workers being only a pandemic-related issue. It has to stay with us, with medical education, with formal systems. And I will, if you let me, just ask, please, Vero Fernandez, my colleague, to share what happened with our international students, which I think we all share also big experience on this pandemic crisis with them. Vero.
Thank you, Mariana. And in the same way that Mariana said, we need to have this issue of mental care as a permanent, not just because of the COVID. In this way, we believe that we can have the same program that Mariana said, that we need to have a support system for the students. We right now have, for example, the program Tech Life, and we use apps, etc., just to monitor the students, how they are, the health, the mental health. And also we have eventually some Zooms to have more face-to-face contact with our students. Right now, we don't have any students abroad, but at the beginning, we had almost 2,500 students that some of them decide to come back, another stayed abroad. So we need to follow all the situation about these students. But right now we're talking to have permanent, also to change the program, for example, online courses, of course, we have to increase this kind of format of courses. But in some point, we decide or we believe that the only thing that we can have more progress on this is to collaborate with the rest of the society. For example, tech has many, well, at the beginning, the start of this pandemic, increased the collaborations, especially right now about COVID. We celebrate many webinars, etc., with many partnerships that we have right now. But also, we would like to have this, like Mariana said, like a permanent activity. We talk about, for example, with U21 Healthcare that recently delivered a declaration of mental health. We're going to start making some activities and research about this issue. So in this way, we believe that COVID gives us the opportunity to take a look about this issue that we almost have in the, forget or missing. And now we have to put it in the beginning point of the student, because there are the human, there have many issues that affect not just the academic. So we believe, as Mariana said, that we need to, this was a very good point to start this work, and we need to maintain in all these curriculum and in all the academic areas, the mental care of the people, of the students, and collaborate. That's what I say about the international students. Fortunately, we don't have any problems. We maintain very good this monitoring, and all the students back right now, and they are fine. Some of them eventually get COVID, but they're good right now. And we have using this app, and we're running this program that Te Queremos is the name from this program, and it's very good for the students and collaborators. That's what I want to share for you.
Thank you, Dr. Fernandez. I think we have a similar experience. Talita here from the international office can confirm this, but we also have every year a lot of mobility, incoming, outgoing. This was a huge impact on our students, especially because those who are successful, they usually get scholarships. It's very meritory, and it was this hit, and they couldn't do so. There was a lot of frustration, and at that time we also had foreign students with us, and it was harsh because the borders were closed. So Talita, would you like to comment a little bit about how this mobility crisis was handled?
Yes, actually, we don't have any students here right now, international students, and we also had some problems with students that are abroad, especially in the US. And we still have 14 students there at Harvard Medical School, but it was a disaster. There's any program right now.
Thank you. Dr. Cantor, would you like to comment on the North American, US experience? Because, US, Brazil, Mexico, Colombia, we are big countries, and we have a lot of heterogeneous communities. Would you like to address a word regarding what we are discussing here, please?
I'm not up to date on the specifics of that, but what you one of the things that you're making me think about is in some countries, parents of students get very involved in these decisions and what happens in medical schools. For example, I've been in communication with medical schools in Japan and South Korea, and one of the problems that deans are having and medical school leaders are having is that in addition to dealing with the medical students and the residents and dealing with the government, they're also having to deal with the parents. And in the US, we don't have that problem. The students are adults and the parents generally stay out of the decision making, but it just, as I was listening to you, I was wondering what the experience was there.
Anyone? I think we are Latin American countries, and usually students are very much attached to the families. I don't know what you. Yes, Mauricio?
Thank you. Probably it's not, well, the attachment to their families, but we also face a problem in Latin America, and is the average age with the one they get into the medical school, because we have a different way to becoming a medical doctor. So we can have students of 16 years or even 15 years starting medical school. So that represents that their parents are completely attached to them, and all the decisions that we take related to today to come back to the hospital, it must be negotiated with their parents. Yes, in one side. The other side, it's that inside of our country in Colombia, we had a lot of people that it's from regions, and they come to the capital city for studying to the med school. So they have their parents in other cities. So it happens that when the first quarantine started, they rapidly go back to their homes with their parents, and borders and flights and highways were all closed. So when the university decided to restart the classes, well, they couldn't come back to the capital because they don't have a way to come back. So were two important problems. And in that sense, universities, they have to understand what's happening and allow that the people that can go physically to the hospital, they can attend. But the other ones, they are still studying in a remote way.
Thank you. Professor Milton, any comments on the vulnerability of some students or those who live far away?
Yes, the public universities in Brazil has now a very important program of inclusion of medical students with economic vulnerability, and this had a very important impact on the learning process during COVID-19 pandemic, because in some regions of Brazil it's not easy to access internet. Some of them don't have computers. So we had a very important challenge to provide them with the conditions to follow the remote teaching. And our university did it. The UNESCO University did it also, and many other public institutions in Brazil also did it. And we have an understanding that economic inclusion must be followed by digital inclusion, because this is the future. We are not, the medical school after COVID-19 pandemic will not be the same that was before the pandemic. Now we are not afraid of online teaching, for example. Of course, to medical school will never be an online program, but some of our contents can be remote. So digital inclusion is very important, a very important issue, and we didn't have this idea before. But in our countries, when we try to include people from different ethnic groups, from different social groups, we must think strongly in digital inclusion. So they will be able to follow all the technological advances that we are including in medical education.
Okay, thank you. So I think we are coming to an end. It was a very productive discussion. And I think the Association of Academic Health Centers has a very important role in expanding all these possibilities of collaboration and also spreading the information, not only here in our discussions, but, as models. So here we can we have to keep trying to connect not only with the students, but also among us in order to produce, more knowledge and also to offer better mentorship for our students and residents. So this is an invitation. Anyone can, take the lead, and maybe we can start a project. And it's easier sometimes to start within the region. So LAC is open for all the collaboration that you can offer. So Professor Cantor, thank you again very much for opening this session. I think it was a very good start. We had already the research roundtable. This is the mental health. And I think we can keep going, right, Talita? Our office is open. Please contact us. And Habiba, can you just show one slide? I think it's a final message for everybody. We can think about ideas.
Yes.
These are like some of the articles. Professor Diaz has already mentioned many, but the two here on the top. So the one here on the right just stresses that burnout, stress, and everything was a present issue before COVID. She has already mentioned that. And our role as educators is, to find strategies to cope with mental health, and especially with students with vulnerability. These are articles from 2020. Maybe it's a look and, think about ideas. So thank you very much, Chris and Habiba and Talita, for organizing this event. And thank you all professors and also the bureaucratic team of the international offices. Elizabeth, thank you so much as well. And have a nice week. And maybe next year, Professor Cantor, we will present a LAC region common work at your annual meeting, hopefully. So thank you, everybody.